Have you been dealing with shoulder pain for months or years? Are you worried that you're going to end up having to have surgery for your shoulder? I can tell you it's the worst pain you've ever experienced. The people that we see that have shoulder surgery, it's a 6-month rehab, and some of them don't get out of pain until they come here. So I want to give you clear information today on how to diagnose your shoulder pain. So is it a rotator cuff tear? Is it shoulder impingement? Is it a labral tear? And then action steps, exercises and mobility work that you can do to start feeling better today and avoid that surgery altogether. Let's get right into the video. First thing I want to do is shoulder test. So this is called yoakums. You put your affected arm over on the opposite shoulder, and then you pull your arm up to see if you can look underneath it. So doing this right here, if this is painful, then you have shoulder impingement. And it's fixable. If you put your arm out to the side, you put it out like this up here, and it starts getting uncomfortable, you start to worry that it's going to pop out of place, then you have a labral tear. Now, rotator cuff is actually pretty interesting. When we've had clients that come in that need surgery, they cannot move their arm. They can barely move their arm, barely do anything. And that is a clear indicator that, hey, we need to go have an MRI. We're probably going to need surgery for this because it's over a 50% tear. We've had success with clients who have a 50% tear or less. We've helped them get the rotator cuff to heal because we put it in a good bed to lie in. Let me explain what that means. So with the shoulder, there's only one bony attachment for the entire shoulder complex. So I have these rubber bands set up here because they're very specific muscles that affect the shoulder. So if we look at it from the front, this is our pec minor. So it allows me to put my arm behind my back. But when I'm sitting at a desk, sitting on my phone, we're always in this hunched position. We call it the office gremlin. So we get in this hunched position, we're laying down collagen, we're getting stiff in these areas. And so then when we go to pull our arm up, we start pinching. That's where the shoulder impingement comes from. So we have to loosen up this muscle and we have to get the shoulder blade to start sitting down on our back. But let me explain exactly why. We have a joint where it's attached right here. It's called the SC joint. This right here is called the AC joint on the top. And then the shoulder, what we all think of as the shoulder is the glenohumeral joint. That's where we have our pain. And then the most important thing that we talk about is the scapula, the scapulothoracic joint. So this is a floating joint. It just glides on the rib cage right here. Why it's so important is because when we raise our arm up overhead, when we're doing anything, that shoulder blade has to move because it keeps our arm in this socket. It keeps it from rubbing and grinding right here. So when you go up to 60 degrees, when you push your arm up to here, this joint moves twice as much as the shoulder blade. So the shoulder blade doesn't do very much when we move up to 60 degrees. As soon as you get past 60 degrees, so I have this space right here when I get to 60 degrees, and then if my shoulder blade doesn't start moving, then I'm pinching off that space. And that's where these rotator cuff tears come from, that we're grinding. My finger is right here and it's grinding into that area. If I do that too much, then I'm getting irritation. I'm getting a little tear and it becomes a bigger tear and a bigger tear because it just slices and slices and slices on that rotator cuff. And that's what's causing you so much pain. A full rotator cuff tear isn't going to cause you nearly as much pain as a partially torn rotator cuff. So we need to really focus in on what's happening with the shoulder blade right here and what's happening with our thoracic spine, because the shoulder blade is moving into the thoracic spine. It's pulling back here. I'm just going to take my shirt off here so you can see how much the shoulder blade actually does with movement. So when we raise our arm up overhead, that shoulder blade is like a wing coming out. So it's opening up and creating space right here for that glenohumeral joint. So my shoulder is able to move right here. Now, when I reach behind my back, you'll see that it pops off of my rib cage. So that's this muscle right here. The pec minor is pulling it forward so that this can tip up. If that's really tight already and we have a rotator cuff tear, then that's going to be really irritated. That's why we can't put our arm behind our back. So we've got to fix that. And we're going to give you the exercise in the video so you can get feeling better today. Now, the third thing I want to talk about with external rotation. So I grab my seat belt right here. You can look at my shoulder blade. When I grab my seat belt, it's going down and in, and my rib cage is moving. So I need to have that mobility right here through the rib cage. That shoulder blade has to be able to dig down into it so that it creates space right here so that I'm not getting that grinding. So now let's get into the exercises. Now that everybody has their clothes back on, we can get into the exercises. What I want to show you is that we've got to increase mobility through this area so that we can get that shoulder blade moving. These muscles are really tight, stuck down. The shoulder blade ends up being glued down to the rib cage because we've been sitting in that position for long periods of time, and our body's constantly repairing and laying down collagen. So I got two tools right here that you can use at your house to be able to do this. I want to take this is like a little double lacrosse balls that a lot of the ladies like, and so guys that are really stiff, because it has give to it. If you get a large double lacrosse balls, it can be too intense. So the towel roll is what we use a lot of times to increase mobility right here. So, and the first thing that we have to do is increase mobility. So now with our first exercise, we're going to go to the floor. Now I've got a lot of tools right here. I'm going to give you some options, but what I want you to think about is we're doing an exercise where we're loosening up muscle tissue. We need to be able to relax and breathe through these mobility exercises. So this is a double lacrosse ball. This one's really big and stiff. This is what I use. I've been doing it for 10 years. It's what I do for maintenance to make sure that my shoulders don't get damaged and don't get hurt. What I would do in the beginning is we always start out with our clients with a towel roll. So I roll this up. This is just a sweat towel, dish towel, and I'm gonna roll it up to where it's a little, like a Lincoln Logs piece. So that Lincoln Logs, maybe we can get a picture of a Lincoln Log. Something in there, because I just wanna increase mobility through my thoracic spine. We always wanna work on mobility before we work on stability. And so we're gonna get to both in this video. We wanna loosen up muscle tissue, loosen up the joints around the area, and then start sparking muscles to stay in that. So what I'm gonna do is I'm gonna lay this down right here on the ground, and I'm gonna work on thoracic mobility by laying. You can do this on your bed. You just wanna make sure that there's something stiff, maybe a yoga mat on top of your bed to make it a little bit stiffer. You can use a full-size towel if it's on your bed. It should be slightly uncomfortable, like you're laying on a towel that's rolled up. So I get a little bit of popping right there. So what I'm gonna do is keep my knees bent, and I'm gonna chin tuck right here, and I'm just gonna breathe for a minute. It should be a 2 or a 3 on a 0 to 10 discomfort scale. So I'm gonna breathe and relax. If your head is not touching the ground, make sure you put something underneath it to support your head. We want our chin to be tucked, and we wanna be relaxed in our neck. So I breathe right there. I'm gonna do it for 5 breaths right there, about a minute, and I'm gonna shimmy my body down and do 5 breaths for about a minute. That's my second spot. My third spot is right in between the shoulder blades. So if my shoulder blade, let's say this is the shoulder blade, I'm gonna start below the shoulder blade. I'm gonna start my second spot is gonna be at the base of the shoulder blade, and my third is gonna be about mid shoulder blade. So I'm gonna set up one more time. I'm gonna lay down right here so you can see it where I am at the shoulder blade. So I chin tuck and I breathe and relax. I want my hands on my chest or palms up, or my arms. If you have the mobility to be able to get here, this is good too. Keep the knees bent, breathe and relax, chin tuck. And then I'm gonna do 5 breaths in each one of these spots. Really focus. I've had clients that it'll start to bother their neck. And so I wanna let you know ahead of time that we don't wanna do this. We don't wanna push with our head when we're moving around. It's just something that we unconsciously do. So 5 breaths in those 3 areas right here. Breathe and relax, 5 breaths. That's my first mobility. My second mobility is that I'm gonna lay down and do it long ways, and we call these pistols, where I'm gonna lay down, and this is gonna be right between my spine and my shoulder blade right here, and I'm gonna rotate into it 10 times. I'm only doing 5 this time, but I'm gonna show it to you on the other side. So now I'm on the left side, and I'm gonna rotate 10 times. So I'm just increasing mobility through my thoracic spine in between my shoulder blades so that I can get that muscle tissue moving and get those joints moving so that my shoulder blade can glide around, because our objective is to increase space for the glenohumeral joint so that your shoulder can actually heal. You'll be amazed at how effective this is when we start getting blood flow in those areas and we allow those muscles to heal, or allow the joint to heal, because we're utilizing the muscles. So that's our first exercise, is two things. We're going this way with the towel roll. You can use a double lacrosse balls like this, laying down. It's the same thing right here. This is just more intense. If you go over a 2 or a 3 on a discomfort scale, it's too much and you're not able to relax. We want to be able to relax through this and take our 5 breaths, move to our second spot, relax, take our 5 breaths, and our third spot, relax, take our 5 breaths. And then I would shift this and do the same thing where I'm gliding. So we call this the pistol. It's because I'm looking down the sights of a gun and I'm rotating. So my knees are coming with me, my chest, and I'm rotating. I'm looking down the sights. If I go too far, I just fall right off of it. So I'll do it the other way, that I'm rotating about 15 degrees and coming back, resting my head. If I go too far, I fall off of it. I want to keep that pressure right there. So I'm loosening up muscle tissue and I'm loosening up joints so that we can start getting that mobility on the backside of our body. Exercise number 2, we've got to loosen up the pec minor, pec major. Both of them are a problem because we've been sitting in this position too long. So what I'm going to do, I'm going to take something like this, a rolling pin. You can use just the rolling pin in your house, dough roller. If anybody doesn't have a dough roller, you need to get one. Okay, so this is a massage roller. We have all kinds of them here at the clinic. This one's for somebody who's a sadistic that likes hurting themselves, but this is a good tool. This is a good tool to be able to work on your pec. So what I'm gonna do, you can do this against the wall, or you can do it on the ground right here. So if your knees are bothering you, we do it against the wall, but I'm right here into my pec, and I'm digging out that tissue. And so I want to spend a minute loosening up this tissue right here on the front of my rib cage right here. So I put it right here. I just need to have a surface that's pushing against it, and I'm loosening that up. And we spend a minute loosening that up. Always do the affected side, but it's really good to do the side that's not bothering you, because when we're doing activity, when we're walking or running or throwing, we're moving reciprocally on both sides. And so it's important that we're working on both sides of our body to even things out. We've got to get it rebalanced in these shoulders. If we want to get long-term solutions, it's all about balance. So we loosen that up. So I spend 1 minute just loosening up tissue on this side. Same thing what we were talking about is a 2 or 3. It should be uncomfortable, but it shouldn't be unbearable. We loosen up this tissue right here. I'm going to do the other side, loosen up this tissue for a minute, and I'm staying in this area right here, loosening that up. And what I'm doing, I'm setting up my shoulder blade to be able to do exercises to use those muscles to get the shoulder blades to sit down and back and create space. Okay, exercise number 3, now we're actually working the muscles. So what we do is we call them I's, Y's, and T's, but we're gonna do a modified version with just a band. We just need a resistance band, and I just want you to stand up, put your arms at your side, and I want you to lead with your shoulder blades. So what I'm looking to do, I can do this and open my arms up and do nothing with my shoulders. My shoulders aren't really moving. But when I do this, I put the band, I put it right here next to my pelvis, and I'm having my palms facing forward. I'm gonna keep my chin tucked, and now I'm gonna squeeze and open my chest up, pulling my shoulder blades together. What I don't want you to do is this either, like pushing your belly out. You push your belly out, then we're just using our lower back. And so we're gonna cause another problem. We don't ever wanna trade problems. So with this, I'm squeezing, and I'm gonna do it 10 times. So I'm holding this band, and it should be fairly easy, but we're teaching the shoulder blade how to glide again. We just loosened up the muscle tissue. We loosened up the joints. Now we're teaching that shoulder blade that it's okay to glide and open up. Shouldn't be painful at all for the shoulder. So I'm doing it 10 times, squeezing those shoulder blades down and back. And this band against my legs creates some resistance. So one way to keep you from hyperextending in your lower back is just to tighten the abs. So we tighten up the abs, chin tuck, and I'm squeezing here. I'll hold it for 2 seconds. Hold it for 2 seconds. Hold it for 2 seconds. And I do that 10 times. And I feel like I'm getting muscles to fire up. I'm getting blood flow in them. And these are the muscles that we want. It's our lower trap, our mid trap, our rhomboids. Now, what I'm gonna do is we call them no monies. I don't have any money, bro. So I'm gonna go right here. I'm gonna put my elbows against my rib cage, keep my chin tucked. Same thing, I don't wanna extend, but I wanna open up this space right here. So now I'm getting external rotation at the same time as my shoulder blade is doing a scap squeeze. I'm doing shoulder blade depression, it's going down, and it's also retraction, they're coming together. So I'm getting, with these exercises, we're attacking two different parts, the shoulder blade and the joint in our rotator cuff. We're using the rotator cuff muscles, but we're getting the shoulder blade to lead the motion, and that's what's most important. The shoulder blade has to lead the motion. Our root cause of our shoulder dysfunction is the shoulder blade not moving. If that shoulder blade doesn't move, remember that it starts to pinch, and that's where we have our problems. So I'm going right here, palms up, squeezing the shoulder blades down and back. I'm gonna rotate, and I'm just doing 10, trying to keep tension in the band, maintaining this position right here, opening the chest up and driving the shoulder blades down and back. Right there. So doing those two exercises, so we have 4 exercises total. The first 2 were mobility, open up the front side of the shoulder, open up the back side of the shoulder and the thoracic spine, and then now get blood flow to the shoulder blades, show them how to glide down and back, and then get blood flow into the muscles with external rotation. Now we're sparking all the muscles that we need on the front end. This is a exercise program that I want you to do for 2 weeks. But you should start feeling better immediately, like your shoulder's moving better. But then after that 2 weeks, we'll do another video with progressions. We have to make the exercises slightly more difficult so you can get stronger and get into better positions. But what I've seen most with clinicians, with other clinics, when people come in here and they've had problems, is that they're doing the wrong exercises at the right time or the right exercises at the wrong time. They don't make progressions. So the exercises can be good, but these are the exercises we want to do in the first 2 weeks. We want to stimulate and spark these muscles, and then we want to start changing the ranges for our shoulders. So leave us a comment and let us know if you're ready for the second exercise video. We do these twice a day. So make sure that you subscribe to the channel, and we'll see you in the next video.